Hey, I'm Madison M. I'm gonna be the nurse today.
I'm Madison K. I'm gonna be the patient, and since we don't have any more classmates in Valley,
We're using a tripod.
yeah, we just have a tripod with the phone set up
And
to
it's in
record.
0.5, so perfect. So, knock, 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 hand sanitize. Hi, I'm Madison. I'm the student nurse. Are you Madison?
Yes, I am.
Okay, perfect. What's your last name and date of birth?
Chemnitz, January 8th, 2003.
Okay, so what brings you in here today?
I'm just here for my annual physical.
Okay, perfect. So I'm just gonna ask you some questions to begin with. So current health status, pretty healthy, anything to worry about?
Nope.
Okay, good. Family history, any cancers, diseases?
Yeah, my grandma on my mom's side has stomach cancer right now.
Oh, I'm sorry. So,
Thank you.
is she still with us?
Yep.
Okay, good. So, past medical history, any surgeries, traumas?
I've had my wisdom teeth removed, and I had some surgery on my left foot.
And everything went okay?
Yep.
Perfect. So, any medications that you take?
Nope.
So, no allergies or food intolerances?
Nope.
Perfect. Any any medical treatments like respiratory dialysis? No. Okay. So, psychosocial. Any stress management that you do?
Not particularly.
And no alcohol, drug?
Nope.
Tobacco use?
Nope.
Perfect. So I think I'm done with all my interview questions. So I'm just gonna ask you some questions about your nutrition. So do you have any dietary preferences, like patterns that you follow?
Nope. No diets. Nothing.
Okay. And what have you eaten the last 24 hours?
I've had a muffin for breakfast.
Okay.
I had some Subway for lunch, and some mac and cheese for supper.
Perfect. So, how much water do you usually drink in a day?
Probably about 50 ounces.
That's good. Do you have like normal food portions or anything out of the ordinary?
Well, normal
Normal food.
portions.
Okay, good. So I think you're well nourished. So I think we're gonna move on to some measurements. So I've already taken your height and weight. So I'm just gonna explain how to do the BMI. So the height is on the left side and then your weight is on the top, and you just meet together on the grid and find your BMI. So I'm gonna write that down. And then we're gonna take your abdominal circumference. So I'm gonna have you lift your shirt up for me and stand up for me. So I'm just gonna.
Here's student. Can I just hold it?
Yeah, sure. So I'm gonna take my little thing here, and I'm gonna measure in centimeters around your widest area. So right by your belly button. That's in centimeters. I'm gonna wrap around you. And while you're taking a breath out, that's in inches. Breath out for me. Okay. Perfect. I'm just gonna write that down here. And I'm gonna do the widest or the narrowest part for your waist to hip ratio. So, one more time. Between the 11th rib and the hip. Okay, good. Then I'm gonna do the widest area. It'd be on bare skin, but for video purposes, it's just gonna be on the hip. Good. And then for the waist to hip ratio, I just take the waist measurement and the hip measurement and divide the both, and that'll give me my waist to hip ratio. So now we're gonna move on to your head, nose, mouth, and neck assessment. So I'll just have you sit on the bed for me. I'm gonna sanitize here again. Just slip that in. So with your head, nose, mouth, and neck, any family history of problems, and no traumas or surgeries that you've had?
Just my wisdom teeth.
Perfect. So I'm just gonna put on some gloves here. I'm gonna inspect your head for contour, shape, symmetry. I'm gonna inspect your skin for color, alignment of your face, and your your scalp for redness, dryness, flakiness, anything like that. So your head looks good. I don't see any bumps. I don't see any redness. Contour and shape looks good. I'm gonna inspect your face here. I see alignment, symmetry. I don't see any redness. Skin looks pink and moist. So moisturizing, do you wash your face every morning and night?
Yep.
And you moisturize?
Yep.
And for your teeth, you see the dentist regularly?
Yep.
Every 6 months?
Yes.
Okay, perfect. And you brush and floss every morning and night?
Yep.
Perfect. So I'm gonna put the bed up here a little bit so I can reach you. Okay, I'm gonna start feeling your head here just for any bumps again, just like I was doing when I was inspecting. So I'm just gonna start down here. I don't see any dryness. Everything looks good. I don't see any dandruff. I don't see any redness. I don't feel any bumps. Contour feels good. So I'm gonna move on to your facial structures. So everything looks good, symmetry, alignment. So I'm gonna feel your jaw, so bony structures. Let me know if anything hurts. I don't feel any tenderness. So I'll have you open and close. Good, no lack of range of motion. So I'm gonna move on to your nose. So I'm just gonna inspect with my pen light here. I'm gonna look on the outside for drainage, contour, symmetry, and that looks good. Then I'm just gonna look in the inside here. Okay, I don't see any sores or bumps or redness. That looks good. I'm gonna test the patency of your nose. So I'm gonna have you cover your left nostril and then blow out and breathe into the other one. And the same for the other side. Okay, that looks good. So now we're gonna move down to your mouth. So your lips look nice and pink. Do you use chapstick? Because they look a little bit dry.
Yep.
So good. I'm just gonna look at your teeth here and your gums. Okay, those look good. I don't see any cracked teeth and alignment looks good. So you do brush, so that's good. And your gums don't look red. And now I'm gonna inspect the rest of your mouth. So with my blade here, tongue blade, moistened tongue blade. So I'm gonna have you say your tonsils look good, and so is your uvula. Okay, and then I'm gonna have you turn your tongue that way, and up. That looks good. Okay, nothing unusual in there. Now I'm gonna take my gauze here, and I'm just gonna palpate your tongue for anything that's unusual. So I'm just gonna hold on to your tongue here. Just pull it to the side. I don't see any redness, and I don't feel any bumps. That feels good. I'm gonna throw that away. And then I'm gonna palpate your soft and hard palate. So good. Doesn't feel bad at all. Okay, so I'm gonna grab some more gloves here. Now I'm gonna inspect your neck here. So position your head on the position of your neck looks good. Alignment looks good. Symmetry looks good. I'm gonna have you test your range of motion. So I'm gonna have you look that way, up, down, shoulders up, and then put your ear to each shoulder. See a little bit lack of range of motion in your neck. Did that hurt a little bit when you?
Just a little bit
Just
tight.
a little stiffness?
Yep.
Okay. So I'm gonna feel a little bit. I'm gonna feel your sternal notch right here, and then I'm gonna make my way up. Okay, that feels good. And then I'm just gonna feel your chest and your neck. Just go inside here. I do feel a little stiffness of your neck. Nothing feels bad, and skin looks good. Okay, I think we're done with the neck. I'm just gonna have you lay down for me, so I'm gonna sanitize again. So now what we're moving on to is abdominal and genital urinary. So any family history of problems again with those? And
Just my grandma has stomach cancer.
Oh,
That's
yep.
about it.
Yep, and then no surgeries or traumas to your areas? No?
Nope.
And you go to the bathroom frequently in the day?
Mhm.
How many do you think?
Ooh, just a couple times a day.
Okay, and no problems?
Nope.
No stomach pain or nausea, vomiting?
Nope.
And you're able to pee regularly?
Mhm.
It's not too dark, you're drinking enough fluids?
Right.
Perfect. So I'm gonna put on some more gloves here. Okay, I'm just gonna expose your stomach here and inspect at the side of the bed and the end of the bed just for some pulsating, roundness, shape, anything to be aware of. So I'm gonna expose, yeah. Okay, so I don't see any redness and I don't see any pulsating. Contour looks good. Good, I don't see any bumps, everything looks good. I'm gonna raise the bed up just a little bit more. Now I'm gonna move on to listening. So I'm gonna take my stethoscope here and I'm gonna listen for the abdominal noises. So I should hear 5 to 34 clicks. Just gonna clean that in front of you. I'm gonna warm it in my hands. So if I don't hear any clicks, I'm gonna listen in each quadrant for 5 minutes. So I'm just gonna warm that up. I'm gonna start in the right lower quadrant and work my way around your stomach. That one's good. That one's good. Good. And good. I heard a normal range of clicks in your stomach, 5 to 34. Now I'm gonna move on to palpating. So you let me know if anything hurts. I'm just gonna look for tenderness and any masses or lumps or bumps. So just let me know if anything hurts. Okay, everything felt good. Now I'm just gonna verbalize what I would do for your genitourinary because we're not gonna do that on video. So I'll just pull this down for you. So I would inspect the pubic area for hair, any lesions, bumps, masses, and that would look good. I'm gonna do the same for your inguinal and your femoral area for any bumps or bulges. So that looks good. And then you've used the bathroom beforehand, correct?
Yep.
Perfect. So then I'm gonna just palpate your bladder area, but I shouldn't be able to feel it. So. And that feels good. So I think we're all done here. I'm gonna document my findings. I'm gonna help you up here. So I'm gonna get up because I don't want you to fall off the bed. Okay, can I help you up here? Do you have any questions? Anything that I didn't cover? No?
Nope, I don't think so.
Well, I think you're all good to go.
Perfect. Thank you.
Nice meeting you.